So at this stage, the patient could hear significantly better, but of course I want to try and remove as many of these hairs as possible. Now, I'm not going to remove all of them, it's just not possible without potentially causing trauma to the ear. So I'm just going to be sensible and remove as much as I can. And with these forceps, with most forceps, they can be quite deceptive. The tip, although it may not appear, it's got almost a pointed edge to it, and that's what gives the forceps that almost like obviously they're called crocodile forceps for a reason. So they kind of narrow inwards and that provides maximum grip. So the distal end, the furthest part away from us of the forceps, has got a slightly pointed geometry, and so when you're going right up against the eardrum, you've got to be careful you don't apply too much pressure, because there's always a chance, if not perforating the eardrum, but bruising it and causing some form of trauma, which can then lead to an infection. So I got quite a lot of hairs out there, and they're coming out in flocks. But I just want to, because the hairs are quite wet and sticky, I just want to suction some of the wet wax off the hairs to make them slightly drier, and that will allow the forceps to achieve a better grip. And just go into the back part of the ear canal just to suction some of this dead skin and wax away. Whilst you're watching that, I've had quite a busy weekend visiting some family over the last week or so, and when I did, I took my equipment with me. One of my nieces does suffer from earwax impaction, and we just wanted to make sure, I removed it a couple of years ago, so whilst I was visiting I just wanted to make sure it hasn't reblocked, because she was slightly complaining that she is not hearing as well. So whilst I was there, it transpired that a lot of the family members had ear problems of various types and conditions, different symptoms. So it was quite an interesting afternoon. So I ended up doing a clinic at my relatives, and had some really interesting cases. One that I'm going to follow up, and the other was removal from one of my younger nieces, and it had really impacted wax and keratin. So it was a challenge to say the least, but we managed, I'm glad to say. So I'm just going a bit deeper now. This is, should I say lower? It's in the inferior recess. You can see I'm just getting the ends a bit closer to get better visuals. I'm just trying to lift away some of these hairs, but more so to just dry them up a bit, just vacuum away any oils and wax, dampness that's coating these hairs, just to dry it up, and it will then allow me to pinch them away a bit better with the forceps. When the hairs are quite oily, they're more difficult to grasp and grip. But again, we're seeing a lot more of the eardrum. You can just see the umbo in the middle of the eardrum. You can see